3 wrong. Students, please be very careful and don't listen to the audience. They are all telling you wrong answers. They are misleading you and misguiding you. Yes, everybody is misguiding you. Believe in me. Yes. The next question. Which of the following is false about non-classical diabetic kidney disease? They do not have preceding albuminuria, much more likely to have arteriosclerosis. There's absence of diabetic retinopathy. Rate of progression is rapid compared to classical DKD. You have to tell the false. So what doesn't happen in non-classical DKD? Okay, teams ready with the answer? Now I'll start checking from that end because I'm every time going on this end. Okay, wrong. Wrong, 2 wrong, 3 wrong. So only 1, 2 is wrong. 3 is right, 4 is right, 5 is wrong. So team 3 and 4 get 30 marks each. Second round you only get. This team gets 1, 2, 3, 4, 40 marks. Second round you got 40 marks. Okay, so we'll move on to the answer. So here the rate of progression is actually slower. All the other things are there. There is no albuminuria, there's no retinopathy, and usually it is because of arteriosclerosis and other comorbid illnesses. Very interesting question. Which of the following drugs may improve sexual dysfunction in women with type 2 diabetes who are depressed? So which drug? It may be useful. There's only one study. So citalopram, duloxetine, bupropion or phenylcypromine. Answers, I will start from this team. 1 wrong. 1 right. Team 5 is right. Team 4 is wrong. Team 3 is wrong. Team 2 is right. Wrong. So 3 wrong. 2. Yours was wrong. Theirs was right. No? 5 right and 2 right. 2 and 5 are right. They get 30 marks each. All right. So moving on to the next question. Which of the following insulin preparation is not a long-acting analog? Is it detamar, glulisine, glargine, or degludec? Which is not a long-acting analog? Correct, 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 right, right. So all are right. Everybody will get 10 marks each. All of the following cross placenta except. So which of these insulin, glucose, ketones or triglyceride doesn't cross placenta? You can use the other side also. Okay. Team 2 is right. Team 1 is wrong. 2 right. 3. This is your answer. Wrong. So far only team 2 is right. Wrong. 4 is wrong. 5 is wrong. So only team 2 is right. Children, what is the answer? Insulin. That's why we gave it during pregnancy. Okay? Right. So with this, we come to the last round, which is dumb charades. So you all know dumb charades? So 2 teammates. One will know the answer and the other will act. I mean, they have to act, and the other one who knows the answer, I mean, we have to find out the answer from their acting, right? We will see your acting skills.
Team 2 leads with 190 marks. Second place, Team 4 and 5 are sharing with 70 marks. Team 3 is in the third place with 60 and Team 1 has 20 marks. 1.
See, Telugu.
Oh, I'll give you the mic. So, if audience is prompting, the team will get negative marks. So, kindly keep your emotions down. Yeah? All in state of nirvana.
Insulin. Pump.
Who's the second lowest? Team 4 and 5. Okay, 5, you have an option to take one slip out of this.
Drug. BP apparatus. Sphygmomanometer. Cuff. PP cuff. Muscle. Hold. Muscle. Cuff. BP. Blood pressure. Hypertension. Hypertensive. Increased. Hypertension. Low. Hyper. Uncontrolled diabetes. Hypoglycemia. Hyper. Where are the kidney. Hypertension nephropathy. Hypertension retinopathy. Myopathy. Complication தான். Sugarsனால வர hyper complication. DKA, diabetic ketoacidosis. Hyperosmolar, hyperglycemic. Kidney nephropathy. Kidney என்ன பம்ப் பண்ணுதா? Polyuria. Brain கிடையாது. கை பம்ப் பண்ணுறோம். ஹைப்பர்டென்ஷன் அது கரெக்டு. ஹைப்பர்டென்ஷன் நெஃப்ரோபதி. pancreas. Hypertensive nephropathy, pancreas. Heart. Back. Where complication? Neuropathy, nephropathy, myopathy, retinopathy, amyotrophy.
No. Time 1 minute. Anyway, he has taken more than 2 minutes. We forgot to, okay, no problem. So we will, I thought he will be able to answer, right? The answer is resistant hypertension.
Device. Insulin. Automated insulin device. Insulin. Dexcom. Insulin delivery device. Sensor. Insulin sensor. Transducer sensor. Continuous glucose monitoring. Target. Time. Intermittent. Time in range.
Very good. And I again request, now any audience who's going to create this problem, I will chuck them out of the room.
Disease. 2 words in a disease. Disease. Lifestyle modification.
Lifestyle modification. You finished.
Abdomen, GI tract, SGLT2 inhibitor. Gastroparesis, insulin tablet, dysphagia, small intestine, tablet, capsule. Time, GI tract, okay. Lower intestine tract.
Yes, audience, somebody wants to come and act? No, you come and act. Now he will act. Answer was gut microbiome. She showed gut GIT, micro kamcha, microscope kamchirkano. Yes. Anybody wants to try? I have one more. So I think we have done with the quiz. This was the 4th round. A big round of applause to all our participants. They did excellent work. Over to Amala to announce the result.
Yeah. So, Team MMC, Ms. Ilam Pirai and Mr. Sasidharan stand first with 190 marks. Team 4 stands second. Also from MMC stands second. And Team 3 with 80 marks stands third.
So now that we have wound up the quiz, we'll go for oral paper presentations. Oral paper presentation. Oral paper, Patel. Ramesh, sir.
Yeah, the best of track. First time in the history of track and the scientific conferences. We are very, very happy and glad to give the opportunity for the youngsters, the postgraduates, who has participated in the free paper presentation in the morning today and scored the first, second and third positions. They will be given an opportunity to talk now. The best of track. Please call the best of track. Will give the prizes and
Prizes will be in the
yeah,
valedictory.
prizes in the valedictory. Okay. You call the.
We'll call upon Dr. Sivashankari to present the. They'll present in our.
Dr. Sivashankari, is he here? Is he there? Vanga Sivashankari from MV Diabetes Institute, huh? Great. Yeah,
Research Associate in MB Diabetes Chennai.
yeah, please come. It's the first time we are introducing the concept of best from the youngsters, okay? Thanks, Dr. Krishna, for this suggestion. Your track as well as.
Very good evening to one and all present here. I am Dr. Shiv Shankari, Clinical Research Associate from MV Diabetes, here to present my paper on declining kidney function is strongly associated with pediatric risk among people with type 2 diabetes. Chronic kidney disease is related to the development and progression of diabetic foot ulcers. The IWGDF has proposed a classification for the assessment of pediatric risk. There is lack of data on the relationship between IWGDF risk stratification and the kidney function, which is based on KDIGO, especially in the Indian context. The aim was to assess the relationship between IWGDF pediatric risk score and kidney function among people with type 2 diabetes in India. We had a total of 6,023 participants included for this observational study from 2022 to 2025 at a tertiary care center for diabetes, Chennai. Participants aged between 35 and 65 years with duration of diabetes greater than 3 years were included for this study. Those with missing data, diagnosed with acute kidney injury and type 1 diabetes were excluded. The participants were categorized based on IWGDF pediatric risk into 4. Stage 0 is very low, where you have no LOPS and no PAD. Stage 1 is low, LOPS or PAD. 2 is moderate, where we have LOPS plus PAD or LOPS plus foot deformity or PAD plus foot deformity. And 3 is high risk stage, where we have LOPS plus or PAD and one or more of the following, like a history of a foot ulcer, a lower extremity amputation, or end stage renal disease. LOPS stands for loss of protective sensation, which was assessed using a biothiometer, where the vibratory perception threshold of greater than or equal to 25 was taken as significant neuropathy, and the ankle brachial index of less than 0.9 was used for the assessment of peripheral arterial disease using Doppler. The demographic, anthropometric, hemodynamic, biochemical details and comorbidities were also recorded. We also categorized the participants based on KDIGO. So here if you see, the green is CKD low risk, the yellow is moderate increased risk, the orange and the red were categorized as CKD high risk. Multivariate logistic regression analysis was done after excluding the participants on dialysis. These are the results. We can see that the distribution of pediatric risk stages across the CKD categories based on KDIGO. When we look at the PR stage 0 and stage 1, there is a significant increase in the proportion of participants. If you see, there is a significant decrease in the proportion of participants from 56.1 to 13.7 and 51.1 to 16.4% across the CKD categories. So this is low risk, this is moderately increased risk, this is high risk. And if you look at stage 2 and 3, there is an increase in the proportion of participants, which is again significant from 26.5 to 45.6, 18.2 to 62.7. When we looked at the median EGFR across the different pediatric risk categories, it declined from 80 to 73 to 69 and then to 59, which were all significant. We also did another analysis where we recategorized the participants and we pulled out the association to check for the association between the pediatric risk and the CKD, where we saw that the pediatric risk stage 0 and CKD low risk, pediatric risk stage 1 and CKD moderate risk, pediatric risk stage 2 and 3 CKD high risk were studied. In this, we found that the participants in PR stage 2 and stage 3 had poor glycemic control when compared to the stage 0 and 1 CKD low and moderate risk. When we looked at the EGFR, again, there was a significant decline among the participants from increasing PR as well as the CKD risk categories. When we looked at the UACR, or the urine albumin creatinine ratio, there was significant albuminuria in PR stage 2 and 3 CKD high risk when compared to PR stage 0 and 1. CKD low risk and moderate risk, and the proteinuria was also evident only in stage 2 and 3. When we looked at the comorbidities and other diabetic complications, we found that the diabetic complications like hypertension, dyslipidemia, coronary artery disease, and retinopathy were all significantly higher in PR stage 3 and CKD high risk when compared to PR stage 0 CKD low risk. Next, we ran a multivariate logistic regression analysis, all the variables which were significant, and we ran a univariate regression analysis, and those with p-value less than 0.05, we ran a multivariate logistic regression analysis. In that, we found that the age categories, increased age, increased duration of diabetes, smoking, systolic blood pressure, increased HbA1c, and comorbidities like dyslipidemia and coronary artery disease were all independently associated with high podiatric risk. And if you look at the GFR categories, as the GFR declines, there is an gradient increase in the odds ratio, which also implies that the declining kidney function is highly associated with podiatric risk. I would like to conclude by saying that our study findings highlight that the declining kidney function is strongly associated with podiatric risk stages of IWGDF. Thus, we have to refer patients early with declining kidney function to podiatric centers to help us prevent the development of diabetic foot ulcers among people with type 2 diabetes and thereby prevent potential complications like amputation. Thank you for your attention and thank you for the opportunity.
Thank you, Dr. Sivashankari. Yeah, please come and take your seat. Next, Ramesh. Next
we
presenter.
call upon Dr. K. Priyadarshini from PSG Institute.
Yeah. Doctors, you can try to complete by 5 to 6 minutes time, huh? As you did in the morning.
Good evening all. My presentation is regarding triglyceride glucose index as a predictive tool, the association of triglyceride glucose index with glycemic control, obesity and fatty liver disease among patients attending health checkup. Regarding TIG index, it has emerged as a novel marker for insulin resistance and metabolic abnormalities across various populations. Recent studies have reported association between TIG index and conditions like MASH LD, CKD, diabetes and even certain types of cancer. These findings highlight the potential utility of TIG index as a versatile marker. Along with TIG index, other modified TIG indices including TIG with BMI, TIG with respect to waist height ratio and reliable marker of metabolic abnormalities. TIG index is usually calculated with fasting triglyceride and fasting glucose divided by 2. Considering the overlapping pathophysiological mechanism involving insulin resistance and dyslipidemia in both diabetes and MASH LD, investigating these indices in the context of people attending health checkup would offer an opportunity to elucidate their role as early predictors of fatty liver disease. Regarding MASH LD, that is metabolic dysfunction associated steatotic liver disease, is the most prevalent chronic liver disease accounting for about 32% worldwide. With increasing obesity, the incidence and prevalence has increased substantially over recent years. All phenotypes are associated with progressive liver injury that can lead to advanced liver fibrosis and hepatocellular carcinoma, can also contribute to the development of other metabolic disorders, including cardiovascular diseases. Among the metabolic diseases associated with MASH LD, type 2 DM is one of the core metabolic dysfunction. The liver and pancreas play a central role in glucose and lipid metabolism. Therefore, MASH LD and type 2 diabetes share a complex and bidirectional relationship with accumulating evidence suggesting that each condition may influence the development and progression of the other. The objective of my study is to evaluate the correlation of the insulin resistance index with respect to BMI, HbA1c levels and hepatic indicators like fatty liver and liver enzymes, SGOT and SGPT. Coming to the methodology, I have assessed around 100 individuals presenting for routine health checkups in a cross-sectional study, and data collected included the demographic and anthropometric measurements like age, gender, BMI, laboratory parameters like FBS, HbA1c, lipid profile and LFT, and imaging USG abdomen. This is a result of my study. Among the 100 persons I have assessed, 58% were male and 42% were female. And among males with high TIG index were around 53%, and among female with high TIG index was around 31%. Regarding USG abdomen, 35% had a normal USG and 46% with grade 1 fatty liver and 19 with grade 2 fatty liver. This slide shows the association of fatty liver disease with respect to various parameters. This clearly shows that the strong association between HbA1c, triglyceride and BMI with respect to fatty liver disease. In my study, there was no correlation between TIG index and BMI with a R value of minus 0.003. However, there was a statistically strong correlation between HbA1c level and TIG index with R value of 0.7. This shows the correlation between TIG index with respect to SGOT and SGPT, which was moderate correlation with R value of 0.3 and 0.4 respectively. This slide is regarding the persons with high TIG index were around 88%, and among them 70% had grade 1 or grade 2 fatty liver with the odds ratio of 7.15. This is the result of my study. HbA1c has a positive correlation with TIG index. BMI does not have a correlation with TIG index, and OTPT have moderate correlation. 35% had normal USG finding and 65% had fatty liver. Coming to the conclusion, individuals with high TIG index are more likely to have fatty liver compared to those with low TIG index, and the confidence interval of 1.79 to 28.5 suggests a statistically significant and a strong correlation. Coming to the statistical significance, the p-value of 0.002 is well below the standard significant threshold, indicating that this association is unlikely due to a chance. Higher TIG index can be considered as a strong predictor or a risk factor for more severe grades of fatty liver, and hence TIG index may be useful as a screening or risk stratification tool for MASH LD. With the increasing incidence of metabolic health issues driven by increasing sedentary lifestyle, it is essential to utilize surrogate markers like TIG index to assess insulin resistance. And also, it is a valuable non-invasive tool that can aid in the early identification, prevention and management of metabolic disorders. The limitation of my study is that the sample size is very inadequate and confounding factors are not included in my study. These are the similar studies regarding TIG index.
Okay, doctor. Well done.
Thank you,
Thank you,
Dr. Priyadarshini. Next I call upon Dr.
Good afternoon, everyone. My study topic is glycemic control in type 2 diabetes patients with obstructive sleep apnea on CPAP therapy, a retrospective observational study. Obstructive sleep apnea is a respiratory sleep-related illness characterized by recurrent episodes of complete or partial obstruction of upper airway resulting in intermittent hypoxia and sleep fragmentation. The disease is associated with derangements in glucose metabolism, mainly by activation of sympathioadrenal system, oxidative stress, and inflammatory changes. So obstructive sleep apnea can cause intermittent hypoxemia, so sleep restriction in sleep depth and sleep fragmentation, which in turn can cause increased appetite, decreased satiety with the release of leptin hormones, which lead to obesity, and the main core process with increased sympathetic neural activity, oxidative stress, systemic inflammation. Mainly markers include interleukin-6 and TNF-alpha, activation of HPA axis, alteration of circulating adipokines. This will in turn lead to beta cell dysfunction, hypertension and insulin resistance, causing type 2 diabetes and further microvascular and macrovascular complications. Prevalence of obstructive sleep apnea in patients with type 2 diabetes is close to 56%, with a higher prevalence in obese diabetics. Prevalence of type 2 diabetes in OSA is estimated to be around 15 to 30%. Studies have shown poorly controlled diabetes can worsen obstructive sleep apnea as well as nocturnal hypoxemia by impacting upper airway neural reflexes that promote airway patency. Continuous positive airway pressure therapy is a cornerstone of management of obstructive sleep apnea. CPAP therapy can help in abolishing intermittent hypoxia and sleep fragmentation, which can overcome abnormalities in glucose metabolism, paving way for better glycemic control. There is a need for further studies to assess CPAP therapy and its influence on glycemic control in diabetics with OSA. So my primary objectives are to analyze the glycemic control of patients with OSA and type 2 diabetes on CPAP therapy, to determine association between severity of OSA and glycemic control based on stop bank scores and apnea-hypopnea index. Secondary objectives include to analyze blood pressure control in patients with systemic hypertension and OSA on CPAP therapy, to assess the trend of BMI of diabetics with obstructive sleep apnea on CPAP therapy, and to compare and analyze the glycemic control of obese versus non-obese diabetics on CPAP therapy. It's a retrospective observational study. It's a study period ranging from January 2023 to 2025. Sample size of 66 patients. Inclusion criteria include age more than 18 years, pre-diabetes and type 2 diabetes patients as per ADA diagnostic criteria, diagnosed with obstructive sleep apnea with polysomnography, available glycemic values at baseline, 3 months and 6 months of follow-up, initiated on CPAP therapy. Exclusion criteria include failure to meet the criteria for type 2 diabetes, not adherent to CPAP, unstable cardiopulmonary, neurological or psychiatric disease, using positive airway pressure therapy or oral appliances. 66 patients with type 2 diabetes diagnosed to have OSA with polysomnography were identified by screening through EMR records. Baseline characteristics, associated comorbidities, presence of diabetic complications, and baseline metabolic profile were collected. Stop bank scores, apnea-hypopnea index were collected. Glycemic profile at baseline 3 months and 6 months after initiating CPAP were collected, along with blood pressure readings. Collected data was tabulated and subjected to statistical analysis. Coming to the results, baseline characteristics include mean age of 62 years with a female preponderance of 53%. The most common comorbidity I encountered was hypertension, close to 60%, followed by COPD, bronchial asthma, and then hypothyroidism. Most of the patients were obese with class 1 obesity close to 40%. 15% of this cohort were smokers, 21% were alcoholics. 36% of the cohort had diabetes related complications. Most common macrovascular complications were encountered with CAD, CVA, and peripheral vascular disease. Coming to severity of OSA based on stop bank scores, most close to 35% are high risk patients, high risk of OSA followed by low risk and then intermediate risk. Severe OSA constituted around 70% of this cohort. Lipid profile at baseline and follow-up was observed a slight increase in total cholesterol and HDL with a static LDL and triglyceride levels. Coming to the glycemic control, fasting and postprandial blood sugars at baseline and then at follow-up at 6 months showed an improving trend. There was a 0.6% decrease across the HbA1c from the baseline to 6 months, coming from mean HbA1c of 8.16 to 7.49%. 15 patients were pre-diabetic. On correlation, a significant reduction of HbA1c levels on CPAP therapy across time was noted, which was significant, statistically significant. A significant association was found between HbA1c levels and severity of apnea-hypopnea index across time. However, no significant association was noted between HbA1c levels and stop bank scores. No significant mean difference in glycemic control was noted between obese versus non-obese groups. Mean blood pressures were static across the study period. There was no significant rise or fall in BMI across the study period. However, a strong positive correlation of SBP and ABP on CPAP therapy over time was demonstrated, which was statistically significant. Diabetic medications for most of the patients were static throughout the study period. 13% however had an increase in their requirement either through addition of OHAs or through initiation of insulin. 85% of patients reported improvement in their sleep. So in this cohort of 66 diabetic patients diagnosed with obstructive sleep apnea, a modest glycemic improvement was achieved on CPAP therapy as assessed by fasting and postprandial blood sugars and HbA1c levels. Besides conventional risk factors, management of associated medical conditions like obstructive sleep apnea can play a major role in glycemic control. There is a large fragment of undiagnosed obstructive sleep apnea in type 2 diabetes patients. Hence, treating physicians must actively screen for OSA in their diabetic patients. Management of OSA with CPAP therapy can not only improve glycemic control but also prevent escalation of pharmacotherapy for type 2 diabetes, which often promote weight gain, thereby worsening the existing obstructive sleep apnea and elevating cardiovascular risk. CPAP therapy can also lead to an improved quality of life as demonstrated by an improvement in sleep quality and in turn cognitive functions. The limitations of this study is a single center study. Confounding factors might have influenced the study outcome. The duration of CPAP usage, drug adherence, other symptomatology related to OSA and its improvement at the follow-up need to be assessed. A longer duration of study is required to analyze the long-term effects on glycemic control. Thank you.
Thank you, Doctor, for that. Local organizing committee members and other organizing committee members to stay back till for the valedictory function. Over to Ramesh.
I call upon the last best paper, Dr. Kalayarasan from PSG.
Good evening to honorable present here. My study is on insulin-resistant diseases as predictors of cardiometabolic and inflammatory risk among populations. Insulin resistance is impaired response to insulin by tissues, predominantly liver, adipose tissues and muscles, leading to altered in metabolism, leading to lipolysis, hyperglycemia, and deposition of fatty acids in liver endothelium, leading to dysfunction and inflammation, causing various complications. As we can see, mitochondrial dysfunction, lipid accumulation, and changes in the adipokinin levels, that is increased leptin and reduced adiponectin, and adipocyte dysfunction, inter-organ communication in obesity-induced insulin resistance, where various theories proposed in insulin resistance. The gold standard for measurement of insulin resistance is the hyperinsulinemic euglycemic glucose clamp technique, but for clinical use we use HOMO-IR, METASAR, TIG index, etc. The need for insulin resistance screening in India is due to, after a study from data from NFHS, it states that undiagnosed diabetes was 24.82% in our population, and the individuals who are around 45 to 49 of age with high BMI and who are in the lower wealth index, and particularly in the southern regions of India, are at higher risk of being undiagnosed for diabetes. So it is a cross-sectional study, and the study population is 232, and the data collected were age, sex, BMI, fasting, glycemic profile, and ultrasound imaging and 2D echography. The objective is to correlate METASAR, TIG index, and HDL by LDL ratio with hepatic markers, glycemic profile, and other parameters like ESR, uric acid, and LV hypertrophy and dysfunction, diastolic dysfunction. The results were the males were around 128, females were 104. The age were ranging between 20 to 70 years, and out of 232, 94 patients had comorbidities, and as we can see, diabetes is 38, systemic hypertension is 35, and these are the various drugs used by the patients. Moving to the results, TIG index had a better correlation with the glycemic profile than METASAR and HDL by LDL ratio, and METASAR had a better negative correlation with HDL. With the correlation with urine glucose, TIG index fared better than other two indices. Moving to fatty liver, of the 232 patients, 41% had grade 1 fatty liver, and METASAR had a better sensitivity in detecting grade 1 fatty liver. And as we can see, the patients with no comorbidities, about 36% had grade 1 fatty liver, and correlating it with FIB-4 score, all these three indices were not statistically significant. And moving to LVH, TIG fared in predicting patients with LVH, and as we can see, patients with people with no known comorbidities, about 13% had left ventricular hypertrophy in echo. But plotting in ROSC, HDL by LDL ratio had a better sensitivity in predicting LVH. Moving to LV diastolic dysfunction, all three indices were not statistically significant, but TIG index had a better sensitivity in finding LVDD. With regard to ESR and uric acid, they had a weak correlation with insulin indices. My final conclusion is that TIG index fared over METASAR and HDL by LDL ratio in predicting glycemic status and LVH and LVDD, and METASAR fared better over TIG index in fatty liver. Thank you.
Scientific Committee Chairman, Dr. Dharmarajan sir, please come to the stage. Add it. Please. Thank you very much, everyone, for staying. Because I had some of our friends saying that nobody will be there for valedictory. I said definitely minimum quorum is assured. And very happy to say Dharmarajan mela vaanga. Sir, Shrikant sir, you are coming up. Do you want to? We are going to have the prize distribution and feedback from our chairman. Few words.
After that, prize distribution.
No, sir.
After prize distribution, before the prize distribution.
Before the prize. I would like Dr. GVK, our chairman, to give a couple of words feedback about the conference here. Because he has conducted a mega national conference at Chennai where 4,000 delegates were registered. Just a couple of minutes feedback.
In fact, I have expressed yesterday itself that I have, okay, first let me appreciate and congratulate both of you and your team, Dr. Rajendran, Chairman and Organizing Secretary, Dr. Balamurugan sir. As I think they have done a wonderful job and a very good attendance for Coimbatore. What I would like to express is that I have seen the passion in both of them. The passion to make this conference, the Track 2025, a big success. The reason why I'm telling, in fact, I'm getting goosebumps actually. I'm telling the truth. See, what I have seen is that both Dr. Valmurugan and Rajendran were always on the toes and made us also on the toes. They kept us also on the toes. In fact, it is very nice actually. See, unless you have a passion, you cannot be successful. The most important thing is the passion. Yes, I want to do it. I want to do it the best. I would like to put my best effort to do that. See, this is what the best quality I have seen both of the teams actually. See, success may come, success may not come, but our effort should be there. Wholehearted efforts that have to be done, and the success will come automatically. And that is what I found with these two stalwarts of Coimbatore. In fact, I have seen them. In fact, whenever we had a online meeting regarding the Track 2025, we expect Dr. Rajan separately and Dr. Balamurugan separately. But they are all together, sitting next to each other and then speaking to us online, on Zoom platform. I know, every time. Not most of the time, every time. So that indicates that the bond that they had for this program. Otherwise it doesn't happen. Okay? So these are all small things. You may not realize it, but these are subtle things which makes a huge difference in making a program successful. This is very, very important. That is gelling of ideas, gelling of the attitudes, and then let us be together. See, you may have different opinions. When it comes to the matter, I'm not telling that they have difference of opinion. In general, I'm telling. But they were able to have a consensus amongst them. That is very, very important. In fact, I've been interacting with both of them in from yesterday. They're telling certain things actually. No, I said like this, and he said, but we came to a consensus. This is what is a teamwork. So team, what does it mean? Together, we can achieve more. TEAM. Together, we achieve more. And that is what is a teamwork. And then I think they have achieved their goal. Congratulations and God bless you. Best of luck in future as well.
Thank you, Chairman. And I'd like to call Dr. Shanmugavelu sir
the chairman with Dr. Krishna Seshadri, both of them have crafted the very, very, very nice scientific agenda, which was appreciated by everyone, not most, everyone of the people who attended the conference.
Thank you.
And people who have seen the agenda and not attended the conference also.
So, dearest all and respected my friends, delegates, I feel extremely happy to see most of the attendees still waiting for the program to come for an end. That is, now the time is 3:40. Still, this is the first time I have seen so much crowd in any of the conferences when we come for an end. That is valedictory function. So I'll finish it off in 3 words. Well planned, meticulously structured, and neatly executed conference. Thank you.
Dr. Paneer Selvam, just quick. 1 minute.
So, good evening to all of you. So, as we all know, Dr. Balamurugan has rich experience with Cupid. So, he has conducted more than 10 Cupids, more than 11. So, he has rich experience. He translated this experience here also, along with Rajendran. They both did well as usual, and everything went on well. Very happy. My wholehearted congratulations to both of them.
Dr. Dharmarajan, Scientific Chair, please come. Dharmarajan generally talks less, he does more work.
Sorry, Dean is on and off the dais. Good evening, everyone. At the outset, I would like to thank everyone for the opportunity given, and congratulations to both the organizing chairman and the organizing secretary for executing this conference successfully so far, so well. Of course, I know the scientific program was chalked out by Dr. Shanmugavelu sir and Dr. Krishna Seshadri, and it was such a good scientific program. I didn't contribute much, I know, but then my associates and my people who worked very well with in sync with Dr. Balamurugan and Dr. Rajendran and the whole team. I think it's the teamwork which ultimately succeeds, and that to extract that kind of a teamwork from the team, we need good leadership and nice leaders like this. So it's an example of how the leader should be, and an example of how the team should be. So kudos to everyone. Thank you one and all the delegates for attending this conference. Thank you.
State Secretary Dr. Bavadarni. I would like our organizing committee members, the delegates who have come, each one from one person from the one team, to give their opinion, feedback also. And somebody sitting from the pharma also can give a feedback.
Very good evening all. It is the continued commitment by both Dr. Rajendran and Dr. Balamurugan, and the cooperation what they had, adjustment, all this made a grand success. And Dr. GVK was saying that they were continuously on toes. Not only they are on toes, they made us all on toes. Till the function is over, we were all on toes. He made us act. Thank you, Dr. Balam.
Shanmugam, come. Next in the organizing committee, delegates, please be ready, and pharma person, one person.
Almost 11 Cupid நடத்திருக்கிற பாலமுருகன் சார் வந்து almost more experienced. Any conference ஒரு வீட்டில் இருந்தே நடத்தலாம். ஆக்சுவலாக தென் பெரிய ஆர்கனைசேஷன் நடத்துகிற ராஜேந்திரன் சார், ஆர்கனைசிங் சேர்மன் ஆல்சோ வீட்டில் இருந்தே கான்ஃபரன்ஸ் நடத்தலாம் 2 பேருமே. ஆனால் 2 பேரும் ஒரு புது கான்ஃபரன்ஸ் இப்போ தான் ஃபஸ்ட்டு நடத்துகிற மாதிரி எல்லாத்தையும் பயங்கர பக்காவாக ஆர்கனைஸ் பண்ணி, மேடம் சொன்ன மாதிரி அவங்க டோஸில் இல்லை, எல்லாத்தையும் டோஸில் வச்சு ஆர்கனைசிங் கமிட்டி மெம்பர்ஸ்க்கும் தெரிஞ்சிருக்கும் இதோட அர்த்தம் என்ன அப்படின்னு. பயங்கர ஹார்ட் ஒர்க்கிங் டு த கோர், எப்படி ஒர்க் பண்ணணும் அப்படிங்கிறது அவங்க 2 பேர்த்துலேருந்து கற்றுக்கலாம். டெஃபினட்டாக இட்ஸ் அ கிரேட் சக்ஸஸ்ஃபுல் கான்ஃபரன்ஸ். அண்ட் லாஸ்ட் இசிலையும் பாஸ் பண்ணோம், ஜிசிலையும் நம்ம ரெசல்யூஷன் பாஸ் பண்ணியிருக்கோம். இஃப் National RSS Day come to Coimbatore, we requested for Coimbatore, definitely with the same team, with the same leadership, we'll make it a grand success. Thank you, one and all.
Dr. Ravindranath, Vice Chairman, done with this.
Good evening, all. Starting from the beginning, almost in the track, it was about to go to Salem. But last year, we EC meeting, sudden decision to change many sarta கொடுத்தோம் பாலமுருகன் வந்து எடுத்துட்டாரு. So உடனே immediately he said okay. நீங்கள் பார்த்தீங்கன்னா from the day onwards இந்த ட்ராக் என்னென்ன பண்ணாலும் ஃபார்முலேட் பண்ணிகிட்டே இருந்தார். எஸ்பெஷலி அவரோட குவிட் முடிஞ்சு நாட் ஈவன் 2 months சார் 2 monthஸில் திருப்பி அடுத்த கான்ஃபரன்ஸ் அவர் எப்படி தூக்கியிருப்பான்னு தெரில. எவ்ரிடே மார்னிங் எனக்கு ஃபோன் பண்ணுவார், நானும் நைட் ஃபோன் பண்ணுவேன். எவ்ரிடே பேசிகிட்டு இருப்போம். எத்தனை ஃபார்மா கம்பெனி வந்தாங்க, என்ன பண்ணாங்க, இது பண்ணாங்க, ஸ்பீக்கர்ஸ். ஸ்டார்டிங் ஃப்ரம் த பிகினிங் நீங்கள் வந்தீங்கன்னா நம்ம சயின்டிஃபிக் கமிட்டியோட அஜெண்டாஸ், ஸ்பீக்கர்ஸ் எல்லாமே மெட்டிகுலஸாக பிளான் பண்ணி டக்குன்னு பண்ணிகிட்டு இருந்தார். எல்லாமே நல்லா இருந்துச்சு. ஃப்ரம் த ஸ்டார்டிங் த பிகினிங் வந்து மாலை போட்டு வரவேற்றது மாலை போட்டு எங்கள் வீட்டுக்கு அனுப்புகிற வரைக்கும் ஒவ்வொன்றுமே என்னத்தை சொல்ல முடியும், சாப்பாடு என்ன, ஃபீஸ்ட் எல்லாம் எவ்ரிதிங் வாஸ் ஒண்டர்ஃபுல். அண்டு டாக்டர் ராஜேந்திரன் சொல்லி ஆகணும். அவர் 2 பேரும் பார்த்தீங்கன்னா எங்களுக்கு வாட்ஸ்அப்பில் காலில் வருவாங்க, வீடியோ காலில் 2 பேரும் ஒன்றா தான் இருப்பாங்க. ஒரே இதில் இப்போ வந்துட்டு ட்வின்ஸ் மாதிரி பேசிகிட்டு இருப்பாங்க 2 பேரும். ராஜேந்திரன் ஹேட்ஸ் ஆஃப் டியூ, 2 பேரும் நல்ல ஒர்க். ஆல் த டீம் ஒர்க்ஸ் எக்ஸலண்ட். டாக்டர் ஷண்முகன் சார், டாக்டர் கிருஷ்ண சேஷாத்ரி அண்ட் அது சண்முகம் எல்லாருமே மெட்டிகுலஸில் பிளான் பண்ணி ரொம்ப கிராண்டாக செலிப்ரேட் பண்ணோம். அண்ட் டெலிகேட்ஸ் ஆல் ஆஃப் யூ, இது ஒரு அப்ரிசியேஷன் கொடுத்தே ஆகணும் உங்களுக்கு கண்டிப்பாக. ஏன்னா நிறைய பேர் சொல்லிட்டாங்க நம்ம இந்த கான்ஃபரன்ஸில் ஆடியன்ஸோட அட்டெண்டன்ஸ் வந்து ஹியூஜாக இருந்துச்சு. அண்ட் ஆல் வேர் வெரி அட்டென்டிவ் அண்ட் எந்தூசியாஸ்டிக்காக இன்ட்ரெஸ்டிங்காக நீங்கள் கவனிச்சிங்கன்னு நிறைய கமெண்ட்ஸு. ஸோ ஹேட்ஸ் ஆஃப் யூ. எனி கான்ஃபரன்ஸஸ் ஆடியன்ஸோட இன்ட்ராக்ஷன்ஸு உங்களோட அட்டென்ஷன் தான் மோர் இம்பார்ட்டன்ட். அதில் தான் எங்களுக்கு ஹாப்பினஸ் கிடைக்கும், எங்களுக்கும் எந்தூசியாசம் கிடைக்கும். நெக்ஸ்ட் இயர் பண்ணுறதுக்கும் எங்களுக்கு பெரிய ஒரு பூஸ்டிங்காக இருக்கும். ஸோ கங்க்ராச்சுலேஷன்ஸ் டு என்டையர் டீம், டாக்டர் பாலமுருகன், டாக்டர் ராஜேந்திரன் and all the team members, and thank you all.
Thank you. From the local organizing committee, who is coming? Dr. Usha, Professor and HUD, come to the stage. மேலே வாங்க டாக்டர், நீங்கள் மேலே வாங்க. ப்ரொஃபஸர் அண்ட் HUD ஆஃப் KMCH மெடிக்கல் காலேஜ், நீங்கள் பெரிய ப்ரொஃபஸர், வாங்க டாக்டர்ஸ் ஸ்டேஜில் வந்து பேசுங்க.
Good afternoon to everybody. At this outset, I am to express my happiest 2 days I spent with all the diabetologists in this conference, especially this organizing committee. Both Dr. Balamurugan and Dr. Rajendran, they were among themselves organizing in a very beautiful way, so that they have made all the youngsters to get involved. This is what the unique in this conference, and moreover I thoroughly enjoyed the PG sessions and the way in which the quiz was conducted, the topic chosen and the discussions we had, and all the more the food arrangements and everything. So thanks to the organizing committee, including Dr. Balamurugan and Dr. Rajendran, and the track other committees, especially Trichy Dr. Shanmugavel. And Shanmugam from Stanley, I know him. So I am really happy that these youngsters, I made them all to stay back, because they should know to work under a team leader like these people is a great opportunity for you all. Thank you, sir.
Anybody who is coming from the delegate side? Delegate side, Gauri வந்து part of the organizing committee தான். ஃபுல் செஷனை அட்டன் பண்ணவர் ரங்கராஜன் சார், வாங்க. ரங்கராஜன் சார் ஆர்கனைசிங் கமிட்டி தான். இல்லை சார், வாங்க சார். ரங்கராஜன் சார் வந்து அவர் ஆர்கனைசிங் கமிட்டிலையும் இருக்கார், ஃபேக்கல்ட்டிலையும் இருக்கார். அவர் இருந்தாலும் எல்லா செஷனையும் அட்டன் பண்ணார். வாங்க. Rangarajan sir attends all meetings, scientific programs, physically as well as virtually. Encourages all the youngsters. Please.
ஒரு மீட்டிங்க்கு முன்னாலேயே வந்துடுவேன், கடைசி மட்டும் இருந்துட்டு தான் போவேன். அது வந்து யார் இருக்காங்களோ இல்லையோன்னு அதை பற்றி இல்லை. நான் ஐ ஹவ் கம் ஃபார் தி மீட்டிங், ஐ ஸ்டே ஃபார் தி மீட்டிங். அண்ட் இட் இஸ் நாட் because that is the way I have to encourage the speakers, the organizers who have taken so much of time, burnt the midnight oil, and they come here to give us something. And only thing is, I wish all the youngsters should come to the meeting and try to learn something which is not being found in the textbooks or not being found in the practicals. See, I came out of the college 55 years ago. It is not yesterday or today. When I was in the beginning stages of my life, there was no CMEs. There was no WhatsApp, no cell phone, nothing. So, the younger generation who are right sitting here, they are all blessed. They have got all the opportunities, and right to add to the spice, they have got the AI. So, they can do any kind of wonders. But whatever is said and done, the seniors should give some sort of impetus to the juniors to follow and come to the meetings and learn certain things which will be useful for the next day in their practice. So this is what I think. And as far as Balamurugan is concerned, he is a very dynamic person. And he keeps himself fit, gets up in the morning by 6 o'clock, going for jogging till 1 hour, then again comes back and plays some shuttlecock, then sees his OP, then takes his phone and keeps on talking to all the people who have been interested in organizing this meeting. And he has been a great impetus to the people who are even not interested, he will create an interest. So that is his way of doing things. So this is a positive attitude, a positive vibration. It will increase your endorphins in the brain. So that's what I say. So because negative thoughts will always pull you down. So always think positive. Whatever has happened today, it will be still more better tomorrow. You think in that way. So whatever hard toil he has put along with the great doyen sitting in the forum, they have done a great job. A big hands to all these people.
யார் வருது? ராஜேஷ். சென்னையில் ராஜேஷ் வந்து நிறைய மீட்டிங் நடத்தியிருப்பார். சென்னையில் வந்து ராஜேஷ் நிறைய மீட்டிங் நடத்திட்டு இருக்காரு. நிறைய சின்ன சின்ன மீட்டிங்கு பெரிய மீட்டிங் வரைக்கும் இருக்காரு. ஓவர் டு ராஜேஷ்.
எஸ் சார். ஸோ குட் ஈவினிங் டு ஆல். 2024 சென்னையில் வந்து எங்கள் டாக்டர் சண்முகம் வந்து ட்ராக் நடத்தினார். ஸோ நான் இப்போ மைண்டில் நினச்சிக்கிட்டு இருந்தேன், இதை விட பெட்டராக ஒரு கான்ஃபரன்ஸ் ஏதாவது பண்ண முடியுமா யாரால் அப்படின்னு நினச்சிக்கிட்டு இருந்தேன். அந்த ரெக்கார்டை கம்ப்ளீட்லி சார் வந்து பிரேக் பண்ணிட்டாங்க. ஸோ இல்லை அப்படி சொல்லலை, எவ்ரி இயர் வி ஹேவ் டு இம்ப்ரூவ். இல்லை ஐம் நாட் இதுவாக சொல்லலை நான், எவ்ரி இயர் வி ஹேவ் டு இம்ப்ரூவ். இல்லை நம்ம ட்ராக்கோட இது வந்து இம்ப்ரூவ் ஆகிக்கிட்டே போகணும். அதுக்கு ஒரு சிறந்த எக்ஸாம்பிளாக வந்து சார் சொன்னார். நான் பர்சனலாக என்ன ஃபீல் பண்ணுறேன்னா, டெடிகேஷன், ஹார்ட் ஒர்க், கமிட்மெண்ட், இந்த மூணுத்துக்கும் பெஸ்ட் எக்ஸாம்பிள் சொல்லணும்னா அது வந்து பாலமுருகன் சாரை சொல்லணும். எங்களுக்கெல்லாம் வந்து நான் இப்போ என்னோடய ஃப்ரெண்டு டாக்டர் கௌரி, எங்களுக்கெல்லாம் பெரிய எக்ஸ்பீரியன்ஸ்லாம் கிடையாது ஒரு கான்ஃபரன்ஸை நடத்துறதுக்கு. இருந்தாலும் எங்களுக்கும் ரெகுலராக அவர் கால் பண்ணி என்ன பண்ணலாம், எப்படி பண்ணலாம், இது ஓகேவா அது ஓகேவான்னு கேட்டுக்கிட்டு இருந்தார். தட் ஷோஸ் இஸ் கிரேட்னஸ். சின்ன சின்ன விஷயங்கள் கூட யாருக்கிட்டையாவது ஏதாவது கிடைக்குமா அப்படின்றத அவர் தேடி அவர் அந்த மாதிரி இது பண்ணார். அதோட வெளிப்பாடு தான் இன்றைக்கி தெரிஞ்சிருக்கு இவ்வளோ பெரிய ஒரு கிராண்ட் சக்ஸஸாக ஒரு ட்ராக்கை நடத்தினதுக்கு. அண்ட் அகெயின் டாக்டர் ராஜேந்திரன் சார், அகெயின் சைலண்ட் மேன். ஐ திங்க் ஹீ இஸ் த ஸ்ட்ரென்த் ஃபார் டாக்டர் பாலமுருகன் நினைக்கிறேன். ஸோ ரெண்டு பேருமே எப்போவுமே எல்லா மீட்டிங்ஸ்லேயும் ட்வின்ஸாக உட்காந்துக்கிட்டு ஒரே இதில் உட்காந்துக்கிட்டு அண்டு ரொம்ப கோர்வையாக அதை நேர்த்தியாக எடுத்துகிட்டு போன ஸ்டைலே வந்து we all really learned from you, sir. You both of us are really an inspiration for all of us. ரொம்ப thanks, and thanks for giving us such an academic feast. 2 நாளும் வந்து from morning to evening வந்து ரொம்ப நல்லான ஒரு academic feast கொடுத்தீங்க. So thank you, really thank you so much, sir. Fine, sir.
Murli sir, former we call him as Dindigal and the MGR. ஜெனரல் முரளிகிட்ட பேசும்போது எம்ஜிஆர் எல்லாருடைய சரி நான் சொல்லலை பேச.
அது திண்டுக்கல் எம்ஜிஆரா சிவாஜியான்னு தெரியாது, தமிழ்நாட்டு எம்ஜிஆர் ஆகிட்டார் பாலமுருகன். இல்லை எல்லாமே அழகாக பேசுனாங்க, மிக அழகாக சொன்னாங்க. பேசுனாங்கன்னா என்ன மனசில் நினச்சாங்களோ எல்லாமே அதை அழகாக சொன்னாங்க. திருப்பி நான் ரிப்பீட் பண்ண வேண்டியதில்லை. சண்முகத்திலிருந்து ஜிவிகே, ரவி, சண்முகல் சார், பண்ணி எல்லாமே அழகாக சொன்னாங்க. ரொம்ப அழகாக சொன்னால் செஞ்சால் பேர் வந்து பாலா அண்ட் ராஜேந்திரன் வந்து ஒண்டர்ஃபுல் பேர். இவர் பேசிகிட்டே இருப்பார், அவர் பேச மாட்டார். ராஜேந்திரன் வந்து என்ன பண்ணுவார்னா க்ளோஸ் சர்க்கிள் உட்காந்து பேசுவார், பட் வெளியே பேச மாட்டார். எதுனாலும் முன்னாடி நிற்க மாட்டார். நீ பண்ணு 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 அப்படின்னாலும் நிற்பார். பாலா வந்து இந்த 2 மாதத்தில் எப்படி 50 ஃபோன் பண்ணியிருப்பார். அப்போ எல்லாத்தையுமே அவ்வளோ ஃபோன் பண்ணாருன்னா பாலாவோட ஒய்ஃப் இந்த 2 months நிம்மதியாக இருப்பாங்கன்னு நினைக்கிறேன். வீட்டில் சண்டை போட வர டைம் இல்லாமல் போயிருக்கோம், அவ்வளோ நல்லா பண்ணியிருக்காங்க. ஏன்னா வந்து இப்போ 3 நாள் ஊருக்கு வந்தாச்சுன்னா வீட்டில் ஒய்ஃப் நிம்மதியாக இருப்பாங்க. பாலாவோட ஒய்ஃப் 3 மாதம் நிம்மதியாக இருந்திருப்பாங்க. எனிவே ஜோக் அப்பார்ட், இட் இஸ் அ ஒண்டர்ஃபுல் கான்ஃபரன்ஸ். நம்ம ராஜேஷ் சொன்னாப்புல 24ல் சண்முகம் பண்ணது, இப்போ இது பண்ணது எல்லாமே ஸ்டாண்ட் அப்பார்ட். ஒன்று கமலஹாசன் டைப், ஒன்று ரஜினி டைப், எல்லாமே பெஸ்ட். ஒன்று கம்பேர் பண்ணவே முடியாது. ஒண்டர்ஃபுல் டீம் ஒர்க். நான் இப்போ ஏகப்பட்ட கோயம்புத்தூர் லோக்கல் கமிட்டியை பார்த்தேன். கிரேட் இன்வால்மெண்ட். பிளானிங் இஸ் அ ஃபண்டமெண்டல். இன்வால்மெண்ட், அந்த இன்வால்மெண்ட் வந்து லீடர்ஷிப் எல்லாமே ஒன்று சேர்ந்ததுனால பெர்ஃபெக்ட் பிளெண்ட் ஆஃப் பிளானிங் அந்த எக்ஸிக்யூஷன், அதனால இவ்வளோ பெரிய சக்ஸஸ். அது ஃபைனலாக ஒன்று சொல்லணும் அப்படின்னா வந்து மாபெரும் சபையினில் நீ நடந்தால் மாலைகள் விழ வேண்டும். அது பாலா ராஜேந்திரனுக்கு 100% ஒர்த் ஆகும். கிவ் அ பிக் ரவுண்ட் ஆஃப் அப்ளாஸ். தேங்க்யூ.
நார்மலாக முரளி வந்து இந்த சிஎம்இயில் பேசும்போது ஏதாவது எம்ஜிஆர் பாட்டு வீடியோ போடுவார். இன்றைக்கி இப்போ அவர் இன்சுலின் வீடியோ போட்டாரான்னு தெரியல, அதை நான் பார்க்கல. அதனால் அதுக்காக ஒரு பாட்டு பாடிட்டார். எனிபடி கம்மிங் ஃப்ரம் த ஃபார்மா சைடு? ஃபார்மா சைடில் இருக்கீங்களா யாராவது சீனியர் பீப்புள் யூ வாண்ட் டு கிவ் எனி ஃபீட்பேக்? வாப்பா. ராமசாமி ஃப்ரம் சான்ஸ் ஃபார்மசூட்டிக்கல் வாங்க. நிறைய பேர் என்ன பாலாஜி இருக்கார், இது புதுசாக வந்திருக்கேன்னு பயந்துக்கிறீங்க. ஏன் இந்த ஃபீட்பேக் எடுக்கிறோம் அப்படின்னு சொன்னால் எங்களை நீங்கள் புகழணுன்றதுக்காக இல்லை, எல்லாருமே புகழ்ந்து பேசுனாங்க, நல்லா பண்ணிங்க. ஏன்னா ஒவ்வொரு கான்ஃபரன்ஸ்லையும் வி லேர்ன். நாங்கள் இதை பிளான் பண்ணதுன்னா இதுலேருந்து அடுத்து செய்யும்போது மதுரைக்கு போகும்போதோ இல்லை இங்கே நடக்கும்போதோ நாங்கள் எப்படியெல்லாம் இம்ப்ரூவ் பண்ணிக்கலாம் அப்படின்றதுக்காக தான் இந்த ஃபீட்பேக் எடுக்கிறதோட இல்லை, நாட் டு கெட் ப்ரைஸ், பிகாஸ் we are very happy about the work what we have done and we see the fruits also. Over to Ramsamy.
Good evening all. Regards from Sans Pharma. So we have been seeing conference across the year, across various places. But when it comes to track 2025, one of the finest conference I would say. As you all know, to make the audience stand is the scientific agenda, where Shanmugal sir, Krishna Shehri sir and Dharmajan sir, they've done a fabulous job. And the hospitality, Balamurugan sir done a great job. So thank you so much for giving this opportunity. And thanks for all the pharma friends. So together we made it happen. Thank you, sirs.
Call the chairman, doctor. Any suggestions or feedbacks வந்து யாராவது சொல்ல விரும்புனா வாங்க ஸ்டேஜில். பழனி குமாரன் ஏதாவது சொல்ல விரும்புகிறீங்களா? பழனி அடுத்து அவர் தான் மதுரையில் கான்ஃபரன்ஸ் ஆர்கனைஸ் பண்ண போகிறாரு. பழனி வாங்க. அடுத்து பாலாஜி வரீங்களா? வாங்க. கம் குயிக் 1 minute முடிச்சுட்டு அடுத்து ப்ரைஸ் டிஸ்ட்ரிபியூஷன் முடிச்சுட்டு வில் வைண்ட் அப்.
Good evening, everyone. So first of all, I sincerely congratulate the team organized by Dr. Balamurugan sir and yes sir. And ஆனால் இதை பார்க்க எங்களுக்கு தான் பயமாக இருக்குது. அடுத்த வருஷத்துக்கு என்னென்னலாம் பண்ணணும்னு உட்கார வச்சிட்டாரு சார். கடைசி வரைக்கும் பார்த்துட்டு போ என்னென்ன நடக்குதுன்ட்டு. ஸோ இதை எப்படி இதோட பெட்டராக பண்ணணும், கண்டிப்பாக எல்லாரோட பிளஸிங்ஸோட நல்லா பண்ணுவோம். ஸோ ஐ சின்சியர்லி வெல்கம் ஒன் அண்ட் ஆல் ஃபார் ட்ராக் 2026 டு பி ஹெல்ட் இன் மதுரை. The date and the venue will be announced later. Yeah, thank you.
பாலாஜி ஈஸ்ட் வெஸ்ட் ஃபார்மா வாங்க. இப்போ தான் ஃபஸ்ட் டைம் நம்ம கான்ஃபரன்ஸுக்கு வந்திருக்காங்க. நல்ல ஸ்நாக்ஸ் நல்லா கொடுத்தாங்க, அன்னபூர்ணா காஃபி கொடுத்தாங்க நேற்றுக்கு.
தேங்க்யூ சார். ஃபர்ஸ்ட் ஆஃப் ஆல் ஐ தேங்க் டாக்டர் பாலமுருகன் அண்ட் டாக்டர் ராஜேந்திரன் ஃபார் கிவிங் அஸ் அன் ஆப்பர்ச்சுனிட்டி டு பார்ட்டிசிபேட் இன் திஸ் கிரேட் ஈவெண்ட் சார். And time to time they were giving lot of guidance how to go about the meeting, and they were giving lot of confidence to us to make this conference a grand success, sir. But I would like to say this conference was very successful, and it is only because of the organizing committee, Dr. Balamurugan, Dr. Rajendran, and all the doctors in it. Thank you, sir.
Dr. Rajendran, our chairman, will give his remarks, and Dr. Ramesh, be ready for the prize distribution. Prize mudichulama. Prize, yeah. Prize distribution. Ramesh, vaanga. The prize winners, be ready.
Very good evening, all. I am very happy to announce the prizes for the poster and paper competition and the quiz competition. We have received 32 abstracts. It is very tough job for the judges and the scientific committee to scrutinize the abstracts and judges the presentations, because all the presentations are done well and it is very competitive. So I am going to announce the presentations, best oral paper presentations. First prize goes to Dr. Lakshmi Priya for winning the Dr. Vijay Viswanathan's medal for best paper, best oral paper.
Yeah, please come. Where?
See, Lakshmi Priya.
Institute?
Institute. Lakshmi Priya from PSG Institute of Medical Sciences.
Our chairman, Dr. G. Vijay Kumar, state chairman, will give this award.
Awarded with cash prize worth 5,000 with Dr. Vijay Viswanathan's medal for best oral presentation. She presented a paper on effect of CPAP therapy on glycemic control in patients with OSA with type 2 diabetes.
Yeah, we are going to help them. Yes. Okay, congratulations.
Second prize goes to Dr. Priyadarshini from PSG Institute of Medical Sciences.
I call upon Dr. Shanmugavelu, the scientific committee chairman, to give this prize, please.
She won a cash prize worth 4,000 with certificate. She presented a paper on TIG index as a medical tool for the glycemic control. Thank you.
Next.
The third prize is shared by two persons. First, Dr. Kalayarasan from PSG Institute of Medical Sciences and Dr. Sivasankari from MV Diabetes.
Dr. Paneer Selvam will give this.
Both will share the third prize. Cash prize worth 2,500 with certificate. Dr. Kalayarasan presented a paper on insulin resistance diseases in diabetes and cardiovascular risk. Dr. Sivasankari presented as a paper on pediatric risk assessment in diabetes.
Dr. Bavadarni, State Secretary, will give to Shiva Shankari. Research Associate, yeah. Congratulations. Next.
Congratulations. We move on to the poster presentation winners. Dr. C. Muralidharan's medal for best poster presentation, won by Dr. Prakash Raj V. from Government Mohan Kumar Mangala Medical College, Chayaram.
Dr. Ravindranath will give this. Yeah, one.
He presented a poster on a rare case of, an interesting case of Wolfram syndrome. He won cash prize worth 4,000 with medal. Next prize goes to Dr. Aditya from Coimbatore Medical College, Coimbatore, for winning the second prize. Cash prize worth 3,000
Dr.
rupees.
Shanmugam, State Treasurer, to give.
He presented a paper on fatal 4 complications in diabetes. Third prize goes to Dr. Priyanka from Coimbatore Medical College, Coimbatore.
Dr. Balaji, former treasurer, please come. Please come and former state treasurer will give this moment.
Dr. Priyanka from Coimbatore Medical College, she won third prize with cash prize worth 2,500. She presented a rare case of Bonjour-Lehmann syndrome. Thank you.
Thank you.
So we'll move on to the winners for the quiz competition. Dr. Silvaraj's medal for the quiz competition winner goes to Dr. K.V. Ilambire and Dr. P. Sasidharan from Madras Medical College, Department of Diabetology. They won the medal, cash prize worth 5,000 with certificate.
Dr.
Puspa, ma'am.
Our chairman, Dr. Rajendran will put, come.
Dr. Puspa, ma'am, from
Dr. Rajendran
MMC.
and chairman and state chairman and track chairman will put. Okay. Track and state chairman. Ilambire, yenga. Wow. Ilambire, okay. Push. On behalf of Ilambire, அவங்களோட வாத்தியார் வந்து புஷ்பா ட்ரெயின் பண்ண டீச்சர் வாங்கிக்கோங்க சர்டிஃபிகேட் கொடுத்து வாங்கிக்கோங்க வாங்கிக்கோங்க ஓகே வாங்க good appreciate Pushpa for the great quiz competition prepared by her son Dr. Abhideep. Thank you, Pushpa. Next.
The second prize goes to Dr. N.R. Aditya from CMC and Dr. T.S. Sudhars from MMC team.
Second prize rendu perka?
Team of 2, sir.
Oh, abdi. Okay.
They won the cash prize.
Yeah, Dr. Dharmarajan will give this.
With certificates.
Kudunga chairmans.
Third prize. CMC, sir. Coimbatore.
Coimbatore Medical College.
Third prize goes to Dr. M. Priyanka and Dr. Syed Muhammad from Coimbatore Medical
Dr.
College,
Dharmarajan,
Coimbatore.
the scientific committee, and he is the director Institute of Diabetology, Madras Medical College, with Pushpa. Please, Pushpa Saravanan. Vanga, please come. Yeah, please come.
They won cash prize worth 3,000 with certificate.
The youngsters who are interested in research, with the permission of our chairman, state, RSSDI is ready to help for research.
Anybody who is interested to do research as a postgraduate or young physician in practice can apply to the RSSDA Tamil Nadu chapter, and we'll be too happy. If it is a very good one, we'll be too happy to help you. The amount definitely will be there. There will be financial assistance will be there, and we are also trying to introduce a course that is on how to do the research methodologies. It's a 4-hour program. We'll be announcing shortly. Keep watching the website and you will know the dates, and it will be a 4-hour program, and that will push you up in research work.
Thank you, Chairman, and over to...
I thank all the judges, quiz master and coordinators of this program, and also I thank the participants, prize winners, KDSC team and Ranmark Pharma for coordinating this event. Thank you very much.
Now over to organizing chairman, Dr. Rajendran, please. Please sit down. Just go here.
As we come to the close of this two-day track 2025, I don't know whether it's a happy moment or the parting moment is a sad moment. But again, we are going to catch up in Madurai. Dr. Palani Kumaran, I think, will collect us together. We have beautiful memories to take home. And Dr. Balamurugan will be giving the valedictory thanks, but before that, my heartfelt appreciation and my gratitude to first to Dr. Shanmugavelu, the previous office bearers, Dr. Muralidharan, Dr. Balaji, the current office bearers, Dr. Rabindranath, Dr. Vijay Kumar, our beloved Dr. Paudarani, our whatever I do, I have one support, Dr. Panneerselvam, Dr. Dharmarajan and Dr. Muralidharan and all. This is like a family. In 2014, this whole thing started off in Coimbatore for the first time. At that time, it was me as a single man who did the same here. So when this was proposed in 2025, when I told Dr. Balamurugan, he immediately took up the idea. Then there was no turning back. From that day, I think it's almost like we have been working towards this. But organizing this conference at this moment in 2025 is at least 20-30 folds more expensive, and even the travel and other things, collecting people. Yes, tireless strategies, tireless hard work, everything had gone in. The only thing that we have earned today is a lot of good hearts, like Dr. Ram Kumar here, Dr. Usha, all the people, if I'm going to name, it's going to take a long time. The best masterpiece was the quiz by Dr. Pushpa, Dr. Dharmarajan gracing the occasion. See, each one of them makes our heart blossom out and glow, get a feel of excitement and a thrill. I thank you from the bottom of my heart, one and all, the former friends, all the people who are associated with us, many of the staff. If I'm going to name, it's going to take a long time. I'll call Dr. Balamurugan. I think he will give a elaborate thing. The gift of this conference is me and Dr. Balamurugan getting together and knowing each other. I think anything comes, I think we have the courage and the ability to face. That's the attitude now we have developed. And like Dr. Murali was saying me, now whatever Dr. Balamurugan is doing, I'm able to see how to channelize, and whatever I do, he'll tactically strategize, channelize. So that blossoms out into a beautiful flower in the final outcome. I'll leave it to Dr. Balamurugan to give the concluding and the valedictory address and address of this track 2025.
Thank you, Chairman. Wonderful evening, and very happy to be here. Happy to listen to all your prizes, all your wishes, and all your appreciations and feedbacks. So, at the outset, I would like to thank the Tamil Nadu RSSDI, the state chapter, and EC Executive Committee for giving this opportunity, entrusting faith on me and Rajendran to conduct this conference in Coimbatore. And so this only gave us a great encouragement, and we have learned a lot of things, because Cupid is our own conference. This is an association conference. We have tried to the best of our knowledge to make the scientific fiesta and everyone comfortable as far as possible. We did. And small shortcomings, kindly bear with us. It is not done, whatever is done is not done intentionally. We try to make the best possible from both of us. Me and Rajendran sat together for many nights. Almost last month, we said alternate days 7 to 11. 11:30 and I went home. So we have tried our best. Thank you very much, and mainly the organizing committee of all the state organizing committee chairman. We have a joint chairman. We have Dr. Ravindranath. Again, Dr. Chandrasekhar is not there. We have two joint secretaries, Venko Jayaprasad and Palani Kumaran, and our treasurer, Dr. Srinivasan. And again, always Bavadarani, Panneer, and Shanmugam, all Dharmarajan, Murali, everyone's, and Shanmugavelu sir. In fact, I went to Trichy personally. So I wanted to finalize the scientific agenda. Shanmugavelu sir said, Balamurugan, we will sit on Zoom and read line by line and finalize. Then I said, no Velu boy, I am coming to Trichy. Give me an appointment. So he gave me an appointment on Sunday, 9:30 night. So the 2 days before, from here I went to Hyderabad for a consensus. From there I went to Chennai to get the IMA State Award. From there I came to Madurai, and from Madurai I traveled to Trichy. So I went to his hospital by 9:15, and 9:30 he finished his last patient and we worked. But after that we have been following. Thank you very much, Irubai, for your wonderful cooperation. Thank you very much for all the faculties who have come. I've been trying to interact with Rajesh, Gauri, Balaji, everyone, and Pushpa, Amala, Rangarajan sir, everyone. Dr. Usha is there, the Venkatesh is there, Sriram, everyone. And Dr. Ramesh has been helping us in terms of organizing the free paper, posters, and each one I just distributed the work. Good leader should not do all the work by himself. We should dedicate, the work. So today you saw the nutrition team, the all-women team in the nutrition workshop did a wonderful job. And artificial intelligence, no need to say about Gauri. Gauri, if we have a meeting, you can have a separate meeting. I'm talking about you only. So Gauri and artificial intelligence workshop, wonderful job. On other two workshop, first time research in in the small clinics, and diabetic foot workshop, everything had a good. People asked, why are you keeping this important workshop at 8 a.m. when less crowd is there? Probably this is a learning for us. From here we move on and try to have a separate registration for, we have decided, whatever program, there will be separate registration for workshop and separate hall. We will take a minimum amount of registration, 30 to 50 people for the registration, and conduct in a separate hall, not in the main hall, so that there will be more close interaction. Again, all the local organizing committee I said, and all the delegates who come, almost throughout the state, delegates have come, faculties have come throughout the state, and the pharma people have done a good support. Dr. Prabhakaran sir is there from the organizing committee. Dr. Ilayaraja has come from Kallakurichi, Raja from Namakkal. So we have each nook and corner, starting from Nagarkoil. We have faculties from Kambam, where I hail from. Kambam is my native place. Kambam, Theni, Tirunelveli, Thoothukudi. So you take any Kallakurichi. So from Hosur also we had a faculty. Vellur, Hosur. So all the faculties, and similarly we had delegates also coming from each nook and corner of that. I feel it's really a very, 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 because the happiness or the price of the pudding is only by when you eating, then only you realize how good it is. So once everybody has come, good footfall on these 2 days, everyone enjoyed. I asked feedback from everyone. All people are very happy. The faculties are happy, delegates are happy, organizing committee is happy, as well as the pharma people are happy. Everyone is a win-win situation. Everybody is happy. And I would like to thank our COVID diabetes team, as well as Dr. Rajendran's team for supporting us, and my family members, and the event management team. Raj, the event management was taken. The audio-visual presentation was excellent. He said, he just noted us that my wife has to be thanked, and my family has to be thanked. Okay, so definitely they've given all the time to the conference, sparing their time. So thank my family and all the postgraduates who come here, and the event management headed by Mr. Ranganathan, and all other members. So மற்ற எல்லாருக்குமே யார் பேர் சொல்லாம விட்டீங்கன்னா nothing is intentional. அனைவருக்கும் என்னுடைய நெஞ்சார்ந்த நன்றிகளை நான் சமர்ப்பிப்பதிலே மிக 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 மகிழ்ச்சி அடைகின்றேன். இந்த கருத்தரங்கு ட்ராக் மிக சிறப்பாக உங்களுடைய அனைவருடைய அன்புடன் ஆதரவுடனும் மிக சிறப்பாக நடந்து முடிந்திருக்கின்றது. இதற்கு உங்களுடைய அனைவருடன் ஒத்துழைப்பு தான் காரணம். ஸ்ரீகாந்த் சார் இருக்கார், ரொம்ப அருமையாக நிகழ்ச்சிகளை கேம்பெயின் பண்ணார். எங்கள் ஸ்டாஃப்ஸ் மணிமேகலை அண்ட் டீம் எல்லாமே இருக்காங்க, ஜெகன், ரஞ்சித் எல்லாமே பேக்ரவுண்டில் ஒர்க் பண்ணாங்க. எல்லாமே சிறப்பாக ஏவி டீம் ரொம்ப அருமையாக பண்ணி கொடுத்தாங்க. ஸோ இந்த ஹோட்டல் மேனேஜ்மெண்ட் they really helped us. Okay, so thank you very much, and thank you all. We'll go for the national anthem. இதுக்கு national anthem இல்ல. Okay. Okay, we'll have a group photo of the organizing committee. The local organizing committee people also please come.